Before getting into the roles, it's important to understand what we're actually talking about. In families affected by alcoholism or substance use, the addiction doesn't exist in isolation. It affects the entire family system. Over time, the family adapts to the instability by unconsciously assigning roles that help them cope with stress, unpredictability, walking on eggshells, and emotional pain. These roles are not chosen, they are survival adaptations, and while they may help the family function in the short term, they often create long term emotional and psychological patterns that follow individuals into adulthood. Hi, I'm Robert Shingleton. Today I'm going to break down each of these roles, how they form, and what they look like over time. What's important to recognize is that these patterns often operate below conscious awareness, meaning individuals may not realize how deeply these roles are actually shaping their identities and behavior. In the family systems theory, we look at the family as a connected emotional unit. When addiction enters the system, everything reorganizes around it. The focus is no longer emotional, health, or development. It becomes survival and stability. In this environment, dysfunction often becomes normal. What is actually unhealthy begins to feel routine. To manage this, each family member adapts in a different way. This process is often reinforced over time through repeated interactions, creating predictable but unhealthy patterns that are difficult to break without intervention. The identified patient is the person struggling with substance abuse. They often become the center of attention in the family system because the addiction creates visible instability. However, in family systems theory, they are not the problem. They are the symptom of a larger system imbalance. The addiction becomes the focal point, but the entire system is involved in maintaining or reacting to it. The perspectives shift. The focus from the blaming the individual to understanding the relational dynamics that contribute to the continuation of the problem. The enabler or caretaker tries to stabilize the family by keeping things together externally. They often protect the addicted individual from consequences by making excuses, covering for behaviors, or absorbing responsibility themselves. This role often comes from love, fear, or a need for control and chaos, but unintentionally, it can allow the addiction to continue by reducing accountability and maintaining the cycle. Over time, this role can lead to codependency, where the caretaker's sense of purpose and identity becomes tied to managing or rescuing the other person. Next, let's got the hero. The hero is the high functioning role in the family. They try to bring stability through achievement, school, sports, work, and leadership. They often take on responsibility early and try to make the family look successful from the outside. However, internally, they may struggle with pressure, anxiety, fear of failure. Their identity becomes tied to performance and external validation. In many cases, the hero is the eldest, also suppresses their own emotional needs, prioritizing responsibility over self care, which can lead to burnout and emotional exhaustions later in life. While the scapegoat carries the emotional tension of the system, they often express the anger, frustration, and dysfunction that others suppress. This may show up as rebellion, behavioral issues, or conflict with authority. In many cases, they become the identified problem in the family. Even though they are reacting to deeper system issues, their behavior is often misunderstood, expression of emotional pain. From a systems perspective, the scapegoat helps maintain balance by externalizing the family's dysfunction, allowing others to avoid confronting their deeper issues. Now let's cover the lost child. The lost child copes by becoming invisible. They avoid attention and conflict by withdrawing emotionally and socially. While this protects them from being immediately stressed, it often leads to emotional disconnection and difficulty forming relationships later in life. Their survival strategy is invisibility, but the long term cost is isolation. They may also struggle with self identity as their needs and voice were often minimized or ignored during development. Here we have the mascot. The mascot uses humor as a coping mechanism. They try to reduce family tension by making others laugh or deflecting the seriousness of the situation. While this can ease emotional pressure in the moment, it often masks deeper anxiety or emotional pain. They learn that humor is safer than vulnerability. Over time, this can create difficulty with emotional authenticity, as the individual may default to humor instead of expressing genuine feelings. These roles form because the system needs stability. In chaotic environments, people naturally develop ways to reduce emotional stress and maintain predictability. Each role serves a function, whether it is avoiding conflict, absorbing blame, or maintaining appearances. However, over time, these survival strategies become rigid identities. This rigidity can limit flexibility in our adulthood, making it difficult for individuals to adapt to healthier relational dynamics. So, the most important concept is this: these roles are not who people are, and they can shift and back and forth between roles, but they are how people adapted to survival their environment. They made sense in the context of chaos and instability, but they often become limiting patterns that continue into adulthood unless they are recognized and changed. Recognizing this distinction is essential for reducing shame and promoting self awareness in the healing process. As adults, these roles often influence relationships, emotional regulation, and identity. People may continue acting out patterns learned in childhood without realizing it. This can lead to anxiety, difficulty with intimacy, or repeated cycles of dysfunction. Awareness is the first step in breaking these patterns. Without intervention, these patterns can also be transmitted across generations, continuing the cycle of dysfunction. Healing begins with awareness. Once someone understands the role they played, they can begin to separate it from their identity. Through therapy, support systems, and healthy relationships, individuals can begin rebuilding how they relate to themselves and others. This process involves shifting from survival based behavior to intentional, healthy living. It also requires developing emotional regulation, boundaries, and the ability to tolerate vulnerability without reverting to old roles. Ultimately, this awareness allows individuals to move from unconscious survival pattern to intentional, self directed living. In conclusion, dysfunctional family roles are powerful because they shape identity, behavior, and relationships long after childhood, but they aren't permanent. They are adaptive responses to an environment that can be understood and changed. By recognizing these patterns, we open the door to healing not just for individuals, but for the entire family systems. And that is the goal of understanding this framework. These concepts come from established family systems theory and addiction research. They've been widely used in clinical social work to understand how addiction impacts entire family systems, not just individuals.